Okay. Here we go.
Okay,
excellent.
We should be all set.
I can see it.
Shrink that. There we go. Brilliant. There we go. Okay, can we get started?
Yes, go ahead.
Great. Like Kim said, my name is Keisha Stauffer. I'm in the marketing department. I'm their communications manager. A brief introduction about me. I've worked at Access Health for 5 years now, since the beginning. And now I work on some of our educational materials, our communications to customers in the form of emails, letters, postcards. I can't take credit for some of those notices they get by mail, although I do my best to work with operations to try to limit things like that. So I'll take a shot at leading you guys through some of the most important places that we direct customers and also our community partners like you. And everyone can see my screen. Hopefully, if you are having problems, please just use the chat function to let us know. I'll be walking through web pages, and you'll be able to see the URL in that browser window. But just in case you missed something and you want to refer back, we will send a list of all the pages we visited with their URLs, just to make sure you have direct access in the future. So let's get started. Right now, we're on the main website, the shopping website. It probably looks familiar to all of you. This is where you can shop and compare health plans and also request help for completing your enrollment. And there's some other good stuff I want to take a second to point out as well. First, you have the alerts box up here. And if you guys aren't aware of this, this is something really important to pay attention to and to make sure customers are aware of. When they go to our website, they'll see some of the most critical alerts we have, which are about things that are time sensitive, things that might impact their coverage. Oh, I see a question coming in. Is there a number to call if you can't get the sound to work?
Yes, right on your GoToMeeting box where it says audio, there's a phone number and you can click over to phone.
Okay, I hope that resolves that issue. So, like I said, this alerts box is really important. We link to learn more content here a lot, and we'll get to learn more in just a minute. Moving on, you see this top navigation, Get Help tab. So I'm going to click on that and just show you guys quickly. This is the zip code lookup for in-person assistance. If you're a certified application counselor or CAC, you might hear me use CAC frequently in this webinar. No, I don't want to participate in a survey, thank you. You can look up anyone who's currently certified through Access Health to provide enrollment assistance. You can look by zip, language preference, etc. For CACs who are on the call, you should be listed in a timely manner on this page, but if you have any issues, we will get to the contact section later, but you should contact our CAC team to make sure that your information gets on this page. This is how customers usually find the closest help to them. So, and these enrollment dates, you'll see, these are tentative. We actually, in case you guys didn't know, these are the draft enrollment dates. They might change for next year, so just keep an eye on that. Okay, last quick stop before we go to learn more. This bottom carousel has links to stuff that customers might need either before enrollment or after enrollment. A couple of things I wanted to draw attention to are the frequently asked questions. You can just flip through in your own time and just see kind of what we have here. There's frequently asked questions here. You can also go and calculate your healthcare costs. This is a question we get a lot from community partners and certified application counselors in our planning meetings. And this is where you would go to input some of your information, a customer's information about medical conditions, and it helps you pick a plan that will, or estimate the cost of a plan for the whole year. So ideally, a customer would visit this before they select a plan to make sure that for their individual situation, they're aware of how much their conditions cost over the course of the year. And then lastly, this individual exemptions form. I'm going to call attention to another link on the Learn More for this. This is important for customers who believe they have an exemption from the individual mandate, so they can avoid a tax penalty and the requirement to have coverage if they apply and then they qualify. So let's see, I think we're ready to go on to learn more. Okay, I'm going to click the learn more up here. As you'll see, it opens up a separate tab, and it's learn.accesshealthct.com. This site is really important for our marketing department. It allows us the flexibility to put educational materials for customers and also to create pages like I'll show you later, just for our community partners. We don't have the same flexibility on the enrollment site, so this is a great place to keep as a reference for you to send to your colleagues if they are also interested not only in learning about Access Health, but in referring people who they see at their jobs to the Learn More site if they want more information about eligibility, about what they should do after they enroll, etc. This page also includes information on our events and anything coming up. Now, I'm going to get to the events page next. One more second. If you see this bottom footer here, this is a quick launch for the topics we see people click on the most. So I'm going to go to events first. Oh, hopefully this works. So while the page is loading, I'll draw your attention to this top again, /events. This page looks a little bare right now, and there's a really good reason for that. We are actively planning our outreach calendar right now, and later in the presentation, I'll call out our request for ideas from you, but we would like, if you have an event in your community or your organization that you think we should be at, if you think there's something that would be really beneficial for us to send information to customers, we would like to hear from you on that. And those events, when we sign up and schedule, those will all appear here, along with some pictures of us at the events if we can get them. So back, I'm going to close this tab out as they pop up, but there. A quick trip to FAQs. We recently reorganized this page to make it easier for customers and for our partners to read. And once it loads, you will see that. I guess our internet's slow here, guys. So if you look through, this is organized by topic, and you can peruse the different questions on your own time. But it's everything from before enrollment, seeing if you can get financial help to pay for the coverage, taxes and what you do with the form that we send you. That generates a lot of questions with customers, and even down to the browser requirements or the best kind of technical specifications for you to view our enrollment site. So these are all things that pop up with customers all the time. And as a general note, if you ever think of a question or you see a question that's not here, please just drop us a line via email, and we'll look into that and certainly add anything that's missing. Going back to free in-person help. I'm going to click on that. So during open enrollment, this page will serve as a guide for customers to see every avenue for in-person help that's available. So right now, it's going to look pretty sparse because we only have our contact center really open consistently for enrollment assistance right now. And again, Monday through Friday, 8 to 4. This is a phone number that you can reach. And as a side note, you'll see different phone numbers here and there. It allows us to track where people are where they saw the phone number. So you'll see 855-805-4325, but they all go to the same place, just as a side note. Okay, going back quickly. There's also a link to download our mobile app. I think there are enhancements scheduled for the mobile app soon, but it is an option for people if they want to go that route. I believe most people just go through the main website, and secondly, they would go to the call center. So it's not our primary channel by any means, but it gives another option for people if they're interested. And finally, on the home page are a selection of videos down here. We have many more videos that I'll show you in a couple of minutes, but these are some of the hot topics right now. This middle one is about special enrollment. On the left, this is keeping your information updated. This is probably our biggest hot topic right now, about paying your first bill and sending us verification documents. That has caused a lot of stress with customers recently. And once you get covered, stay covered. That video is also about keeping the coverage by paying bills and sending documents, but also what you should do to use your plan best, like going to your PCP, making your annual checkup appointment, etc. Okay, so now for some fun stuff for our community partners. I'm going to, oh, here we go. Click up here. And it's loading, it's loading. Okay, so this is our page dedicated to community partners. And you'll see the URL up here, /community. We include information for certified application counselors on this page as well, and you'll see that as we go on. A couple of really important things to point out. If you have questions about partnering with us or anything outreach related, this email address, outreach@accesshealthct.com, is the one you want to use. If you have an event that you know about that you want help on, if you have a question about printed materials, anything like that, please just use that email address. Another important thing to call attention to, this link to sign up for our community newsletter. We send out a lot of great information in that newsletter. It includes dates for new webinars coming. It includes regional meetings where you can meet other community partners and talk to us about issues you're seeing in the field. And it also could include some guidance on some of the federal changes that are coming. We get a lot of questions about that, and while we currently don't have any more insight than most of you who just read the news, as things develop, we will be developing guidance for both the community partners and our customers, and also our certified application counselors and our brokers, just so everyone is equipped with enough information to answer questions from customers. So let's see. Okay, let's start with announcements. So whenever you get to this page, just give a quick look on the announcements tab, which is selected automatically for you when you visit the page. There's a lot of good stuff here. I'll scroll down for you to see slowly. It includes references to initiatives going on, like the Share Your Story initiative. I will show you that page towards the end of this webinar, but in general, it's another great way for us to gather stories from customers about what having healthcare means to them. You've probably seen this on social media a lot lately. A lot of organizations are doing it, states are doing it, and on a national level, a lot of people are trying to kind of drum up some positivity around the ACA. And it's not hard to do. There's a lot of great stories. So again, I'll bring you that page in just a few minutes. For certified application counselors, I'm going to highlight this section down here. We keep this updated as our staff structure changes, and there have been a couple of changes recently with Dave Lynch and Gigi. So just pay attention to how we've broken this out for you. It tells you which issues to contact, or who to contact with which issues. And of course, if you ever reach out to a different person than you're supposed to, we will circulate and get you in touch with the right person. Okay, back up here. I'm going to click here. So events, training, and speaking requests. Our regional planning meetings are a great way for you to get in touch with other community partners and also to sit with us and tell us what happened in the last enrollment period, what worked, what didn't, and more importantly, to give us constructive criticism and suggestions for moving forward. We're still planning our outreach for the summer and fall, like I mentioned, so any suggestions you have on communities we're not reaching or towns we're not in or ways to get in touch with customers. For example, if you want to put a link to us on your web page for customers to see. Anything like that to increase our visibility would be really helpful. So we're definitely looking for more input from you guys in those meetings and really any way.
Also, I just want to put in there, any coalition meetings you're a part of, it's really handy for me to go to coalition meetings. This is Kim, because then I get to meet a lot of people from a lot of different organizations. So just shoot us a line.
Great, great plug, Kim. Love it. One last note on planning meetings. We have 2 coming up in Stanford. you can click these links to register. And again, we will be sending a list of all the URLs we visited. So if you can't get back to this on your own, we will help you get back to this registration page. Going down are webinars, just like the one you're on now. You'll see it listed here in the description. We're glad you found your way to us. There will be webinars in the future, and there are webinars in the past. You can go and view previous webinars, which is a great way to brush up on any topics that you might need some refreshing on, and also to explore new topics. Some of my favorites are on there, and let's see. This webinar will also be posted here. Kim, do you know when the webinar will be posted?
It's usually within the 48 hours.
Okay. So again, there are English and Spanish here. It's a live recording of the webinar. And if you have ideas for new topics, please let us know. Don't want to miss out on any good ideas out there. Going down. I know this is a lot of information on this tab, but we've got a lot going on right now. You'll see the materials from our community conference this past October. If you want to look through and see kind of what we discussed, there's a lot of really good stuff here. You can download the presentations and take a look at what was presented. Let me scroll down here. There's a lot here. Let me see. Okay, and I wanted to make sure I got down here. This is very important. Requesting a speaker, letting us know about an event, and requesting training. So make sure you come back to visit this page if you've got if you have an idea for an event, but also if you want someone from Access Health to give a presentation at your organization. This could be a great way to give your staff an ACA 101, an Access Health 101 discussion. We are more than willing to come out and support you in educating your staff on what Access Health does, and also requesting training if you'd like to become a certified application counselor. This section will be updated in the next few months with more information about the training for next year, so I can't really speak to it, but there will be a link here for the learning management system, and that's where you actually take the training, and in the future you can log back into your learning management system account and view old modules, which has been a request from CACs wanting to, again, refresh what they learned in training and have a reference, a quick go-to reference. So similar to all of you could go to the webinars and see kind of how we've, our little dive into each topic. Anyone who's certified, of course, can go refresh themselves on all that great information. Let me go back up here, all the way back up. Printable materials. So you'll see English and Spanish materials here. There are some materials that are from open enrollment, so when you download these, you're going to see the open enrollment dates, but a lot of the information is still good, and rather than throw the baby out with the bathwater, we kept these up here. Still a lot of good information about eligibility, financial help, filing your taxes, etc. So this is a great place for you to either send your colleagues to download materials and distribute them amongst your organization. Great reference. So let's see. Oh, another note. Last year we distributed 12,000 of our brochure. Let's see, just click here, to community partners like you. And we are open to doing that again if people express interest. I know that sometimes budgets are tight for printing, and we understand that, and our budget's also tight, but we do prioritize you guys to make sure that you have some at least general information like this at your organization. Click back. Okay, let's see. Social media and logos. So I think I mentioned before that another way for you to help increase our visibility is to post either on your social media page or your newsletter or your web page. Here's where you could go to get some logos to post on your page. And also our social media links are right here. And I want to call special attention to this YouTube link. This has a wealth of videos covering educational topics mostly, created by our staff and by some of our marketing partners. So That's a great resource there are some longer videos, like the tax issues, that take a little longer to explain, but there's also some quick 30-second references that act more like a checklist for customers, approaching enrollment and also after enrollment. So another great place to go to send customers for more interactive content, a little more fun stuff. Okay, going down, questions, who to contact. I think I mentioned before, again, this was listed at a different tab. We wanted to list it twice just in case you couldn't find it. This is specific contact information for certified application counselors. If you're a community partner, again, if you have any ideas on community outreach, any questions, you want to call Kim, who is next to me, at this number, or email at outreach@accesshealthct.com.
Also goes to me.
Also goes to Kim. Smoke signals also go to Kim. Okay. Another important point, customers ask us all the time about instructions on paying their bill. How do I find a doctor? Where do I find the prescriptions that are covered in my plan? We actually don't, we don't provide that information because it's not our information to provide. We link to the insurance companies directly in all those cases. So for customers who are looking for a resolution on things like paying their bill or finding a prescription drug, hey, is this covered under my plan? This is a good place to send them or to guide them through. Let me just see here. And finally, our newsletters. So we just restarted doing our newsletters right at open enrollment. So you'll just see 5 newsletters here, but this is an ongoing project for us. So you will see newsletters posted here as they are sent. And again, another plug, if you click here when you return to this page, please sign up for our email community newsletter. There, in next month, there should be a link for you to forward it to a friend or colleague. That's an easy way for you to send them a sign-up form, and then they can complete it on their own. Because actually, if you receive our emails and you forward it directly, and that person unsubscribes, it unsubscribes you too. Isn't that nice? So we're going to try to make that a little easier for you guys to spread the word for us. So thanks again for doing that. Let's see. So that kind of covers the community page, and this is where you guys will find most of the information that's relevant to you specifically, but I'd like to take you through a couple of pages that are really important for customers. And these are pages you should be aware of because they're going to cover a lot of the questions they bring to you. And also, once you have that list of URLs, if you're in contact with customers via email, you can really easily share with them a page that explains the concept that they're maybe having questions about. So I'm going to start with use your plan. And actually, you can get to this from the top navigation. So it's very visible. So let's click on use your plan. How am I on time? 126. Okay, we're doing good. So once customers enroll, we want to make sure that they're aware of what comes with their plan. The 10 essential health benefits, we've tested this in focus groups and in surveys, and there is still a low awareness of what actually comes with your plan, and that has an impact on how customers view the value of the plan. And that's one thing we're really trying to educate people on. And you can see here, we've listed out some of the things that customers should do after they enroll to get the most out of their plan. And I won't read through this verbatim, but it's got a lot of good ideas, excuse me, for customers. And also these are things that you can convey to customers that, hey, once they complete enrollment, hey, make sure you ABC. And that would be really helpful as well. See, choosing a PCP. Okay, that's from you, Kim. Okay, so moving on, I wanted to, let's see, I already showed you insurance companies page, so I'm going to skip forward to managing your account, the second tab. Again, a quick video here for customers, I think it's 30 seconds, explaining the steps after you enroll to keep your coverage. This is our most critical issue right now for customers. We have a lot of people getting canceled or terminated, rather, their coverage being terminated. And in most cases, they cannot get reinstated. So this is very important. We've heard a lot of issues with the notices people are getting and that they can be confusing, and sometimes the timing of them completing their requirement doesn't match up with the notices, so there's a lot of confusion. So for you guys to better serve the customers, just make sure you're aware of all this information, including instructions on how to verify documents. We've heard a lot of feedback from CACs, especially on this topic. So make sure you're aware of how, and again, always reach out to us with questions if you have them. We've gotten a lot of great suggestions on this page specifically, and I'll say this suggestion now because it might come up in your questions, but having a better reference guide for customers on what documents would satisfy the requirement from Access Health. So that's an example of something that you'll see coming on this page really soon. For example, if you get a letter asking for identity verification, list the 10 documents that satisfy that requirement. Very simple. Seems simple. We didn't have it up yet in exactly that form, so we are going to put that up. And if you ever have any other suggestions, please send them along. Okay, so I won't go through those. And finally, one topic that causes a lot of trouble for customers is reporting changes. So unfortunately, if you don't report changes to certain information, like how much money you make in the year and your zip code, you might be surprised with a very large tax bill at the end of the year. So in addition to encouraging customers to complete their enrollment, which, as I said, is making sure you pay your bill and confirming your application by sending us verification documents, in addition to that, we want to make sure that throughout the year, customers remember that anytime something major changes, they need to report it. It could have a really negative impact, and actually, in some cases, I think it can cause you to lose your coverage. So calling attention to that. Let me make sure I'm not missing anything. Okay, I think we can move on. Again, up at the top here is our resources page. Loading. Again, the URL /resources. So this is our repository for our educational videos, all of our printed materials. We have things in English and Spanish. And we also have a video blog called What's Health Got to Do With It? And a quick note on What's Health Got to Do With It. This is a really great video blog led by our two team members, Kim and Manny. And it's intended to reach out to millennials and to give them some kind of insight on purchasing health insurance, what they should know. It really tries to get at the millennial audience with the message of kind of why care about having health insurance and how to get it. Let's see. For these flyers, if you take a look later and there's any topic that you see that we haven't covered, please send us a note. We might already be working on it. We do have a few ideas for how to add different kind of one-pagers on topics that are coming up, but please always reach out and let us know what you think should be on this page. So, I don't know if I'm going too fast, but I'm almost at the end of my presentation. So we're going to go back to the home page, and as I promised, we're going to take a look at the Share Your Story project. So here we go. So I'm accessing this from the home page carousel, but you can also use the direct link that you're going to see in just a second. It is /share. Okay, we've arrived. So this page includes a lot of interesting data that we gathered on our customers and on Connecticut as a whole. We are going to continue to update this as we do more research, but in general, customers received an email that kind of summarized their health care last year. And the goal behind that is, like I said before, to kind of educate them on the value of their plan, but also to call attention to the financial help that they might have received to help them afford that plan and how important that is. And you'll see they're in good company. 80% of our customers, almost 80%, get financial help to pay for healthcare coverage. So the idea behind, and then I'll say the main point of this page is to not only educate customers of kind of the context of Connecticut and healthcare, but also to ask them to share their story with us. We know 9 out of 10 Connecticut residents have healthcare coverage, and we'd like for them to share their story. they don't necessarily have to be, you know, an ACA customer right now. A lot of people have past stories, maybe like, hey, that got me through a really tough year, but kind of looking for you guys, for customers, spread the word, help us gather these stories. We've gathered over 50 testimonials so far, and what we've been doing as we go is we're creating these little images. These are can be shared via social media, and we will post them on social media, and just pull out some quotes from customers who have submitted them, or individuals, I should say, who submitted a testimonial, and try to share the good news, so to speak. We will be updating this page as we go. If you can share a link to this page to your colleagues, to your customers, if you know of a really great ACA story or healthcare coverage story, reach out to them, send them this link, encourage them to sign up and to share their story with us. They can also upload a picture. This is a recent addition. Let me make sure I didn't miss anything. And I think that's it. So yeah, I know we ran through a lot of information, but again, we'll give you guys a list of the URLs, and you can go back through at your own leisure and kind of poke through the different sections of this page.
That's terrific. Okay, I'm going to go back to the PowerPoint here. And so, are there any questions? Thanks, Keisha, for doing a terrific job.
Yeah, thank you.
And if you have questions, just type them right into the chat box. One question I had gotten earlier was, are the printed materials that you can print off the website, are they available in any other language besides English and Spanish?
Well, that's a good question. So we get that a lot. We have a lot of languages represented in Connecticut. Right now, our main materials are just in English and Spanish, but our very basic general brochure is in the process of being translated into 13 additional languages. So we will have a little more coverage in terms of language accessibility. Now, we do, as a side note, we do rely on our community partners a lot to serve as ambassadors to people with limited English proficiency. So while these materials, we know these are not a replacement for the support that you guys give, but it's really helpful for us, or it's really important for us to make materials in the language that people are comfortable in, so in the very basic sense, they can understand who we are and what we offer.
That's terrific. And let's see, the other question that came in is, will there be a list of the pages that we visited today?
Yep, and there definitely will be. And I'll see what other helpful information we can include in that communication, maybe another list of the contact information, some other stuff, a high-level summary of what we discussed today.
That's great. And also, if you all on the webinar, if you think of anything that you didn't see on the website that you think it would be great to have, shoot me an email and I will pass it along and we'll see what we can do.
Right. I mean, now that since we're on the line, if anyone has a page of the Learn More that they want to look at right now, let me know. Next couple minutes, we can take a look together.
And I do want to remind you all that I put a link to the survey about this webinar up at the top of the chat box, and it just takes like 2 seconds. If you all could fill out that survey, we would deeply appreciate it, because we always want to make sure that we are providing webinars that really are helpful. So we want to make sure the webinar went okay as far as you're concerned, or we also want to know what kind of topics you'd like to see going forward, because we're happy to basically present whatever you need. Can you show the info from last year? All right, I'm going to make Keisha the presenter again, and we'll go back to that. Okay.
Okay. Headed back briefly to the community page.
Okay, so this is the learn.accesshealthct.com/community where you're starting.
I want to go down to events, training, and speaker requests.
And then scroll all the way down.
And here we go. And we do plan to hold another community conference this year. We don't have a date set yet. Last year it was in October. Was it in October?
Mm-hmm.
And I mean, one of the challenges will be, let me see. You see this page okay? Good. Yeah, so like I said, we will be scheduling that, and we'll reach out to our community partners and our certified application counselors to not only invite you, but perhaps to solicit ideas for topics that you'd like to be covered.
And there's another question, how do you get to the Learn More tab in the first place?
Okay, so there's two easy ways that you can get there. You go to accesshealthct.com, which is our main website. I'm going to click back really quickly to that. The Learn More tab is right up at the top. You can see this right here. Another easy way, open a new browser tab. It's learn.accesshealth.ct.com. That's a direct link to the Learn More page. And it does exist as a kind of separate microsite. Now we'll click back to our community page really quickly. Yep, let's see, workshop materials. We had some really great speakers, national leaders in some of these topics, and it was so fascinating to hear them discuss the issues that we deal with on a daily basis, and also their understanding of the national trends involved and kind of where things are moving forward. Was really, really informative. Now, I'm sure given the election and some of the recent goings-on, it'll be a really interesting conference next year as we all look to grapple with the changes happening, and we'll do it together.
I'm sure by that, or I hope by that time, there will be a little bit more clarity on the direction that the ACA is going.
Right.
And we will be sure to provide that information really as we get it. Keep an eye on the newsletters.
Yeah, another plug, reminder, sign up for those newsletters. So let's see, did that answer everyone's question?
Yeah, I think we're basically good. So
okay.
I am going to go back to the PowerPoint. And say thank you to everyone for taking time out of your day. We really appreciate your joining us on these webinars. And again, that outreach at accesshealthct.com. Any questions, comments, invite us to events, anything that's really partner related, send me an email and we'll get right back to you. So thanks again.
Thank you guys so much for supporting our efforts.